For me, I really liked that global health emphasizes prevention at the population level is vital to helping maintain global health security. I also thought that global health is important because it really aims to improve health worldwide, access to healthcare services, as well as the quality of healthcare for all. So fast forward to today, it's clear that we're very much in an interconnected world where infectious diseases are a threat anywhere and can present as a threat everywhere. Really, past decades have seen how there are those newer pathogens emerging. There's also those older pathogens that are resurging. So when we think of SARS or avian influenza, H5N1, Zika, and of course now, the COVID-19 pandemic, these are all those examples of those new and reemerging pathogens that we've really seen tremendous impacts on human, animal, economic health across the globe.
People just really don't understand the science, and it's not their fault. It's not something that we teach. We don't talk about vaccines until somebody needs a vaccine. People don't ever question those other, laws that are mandates on their personal, privileges, so to speak, but yet they do it with this. And so it's not logical, but it helps to keep that in perspective. We are doing it for the public good. We know the science, we trust it, we know it's safe, and we know it's effective. So we would never ask anyone to do something that we wouldn't have already done ourselves.
There's this beautiful saying in English, I know enough to be dangerous. And that kind of like little piece of, yes, you do get little bits and pieces because it's constantly moving. But what of those pieces do you actually take in? Which of those pieces do you trust? Which of these pieces do you build on? And where's your tribe in all of this? And are they with you on board?
COVID is a uniquely horrible thing to communicate effectively about, because what we knew was evolving.
I'm an optimistic person for the most part. So I'm kind of like, hey, is this a teachable moment? Can we stop in our tracks as an industry, as a country, as a globe to say, is this the right route we're taking for information? Are there better ways to do it?
We need to make sure that we go back to we're in this together. We're stronger if we're together. We all can do this as a better job if we're all in this together, and if we're helping, understanding, having empathy for the other side. If there is someone who does not believe in a vaccination, why is that?
I'd say the parallel is this is the same sort of investment you make when you invest in your town for a fire department, right? We don't want there to be fires. We're not investing to have fires. We're investing because things happen. Fires happen, and we want to be ready for it. And same thing with the pandemic. We want the fire station there, if you will, the ability to manufacture vaccines on short notice, the ability to create them and test them on short notice. And that takes investment to build it and have it ready and have it stocked and available to go. But just as a fire station, when the fire starts, you need to call 911 and have the fire department on its way in minutes. And same thing with the next pandemic.
So for me, I think ultimately is either we innovate for infectious disease prevention, detection, and response, or we perish. But for us to do this, we have to realize that when an infectious disease is detected somewhere, with the volume of travels globally, it is very easy for this infection to be carried within hours, to major cities around the world. And it means that in innovating for global health security, we have to work as a community.
I think in times like this is when we are put in a position to make a choice to face an adversity and actually prepare ourselves and have a proactive measure to prevent the next pandemic. And the only way we can do that is through proper knowledge, getting factual information, knowing how to utilize it, and also prepare ourselves on how to overcome future deficits.
We cannot afford that as soon as this pandemic fades from memory, complacency takes over in what has been dubbed a cycle of panic and neglect. I want to echo the Independent Panel for Pandemic Preparedness and Response, stating this cycle must end. In this sense, we cannot afford to squander this unique moment in time. We have an enormous momentum right now. And this is a point in time where we can jointly prepare for and prevent future pandemics. It is, I want to say this one more time, about one health, one planet, one future. it is something we need to do together and we need to come together on.
And this is, one of the hardest things as an academic to talk about, because, all of our training as physicians or physician scientists says, you're not supposed to talk about Republicans and Democrats or conservatives or liberals. We're supposed to be above that or beyond that. But, I haven't found a way to talk about it other than to talk about it. And it's not that I'm politicizing vaccines. They are. And I'm basically saying, look, you're entitled to your conservative viewpoints, but don't adopt this one. Don't adopt this anti-science, anti-vaccine stance, because you'll lose your life. And it's become such a killer in the United States. And it's one of the toughest things I've had to go up against.
We need to educate that the facts that we're getting are facts that are at that point important and is what we have at hand. But that does not mean that this is actually going to be it for the rest of our lives, because it's moving. It's a moving target. It's never going to be static, especially in a world that goes so fast, and it's going to continue to go faster, right?
National security, yes, because if we're not all together, then we're all divided, obviously. But with keeping, it's why I've, considered the emotional impact on how COVID has affected all of our businesses is a primary importance, because I think that a lot of people were like, okay, I've got mixed messaging and I'm told to stay home. Now I got to put a mask on. I am super frustrated. How in the heck am I going to feed my family, and get all these things done? So I think that, I think that's a great way is we come up with approaches that people can agree on rather than trying to change their mind about something.
We see across the world how health isn't accessed at the quality and care that everyone deserves. So the more we not only delve into the human rights issues, but also the science of it all, and help people understand what seems to be very complicated topics. As soon as you make it more accessible, then healthcare and access to science and trust becomes incredibly more accessible to the public.
It's critical to get the information out to the public, particularly about the safety aspects, the efficacy of the vaccines. There's probably about a dozen vaccines throughout the world that are being used. There is so much information available. Some of it's accurate, some of it's inaccurate. And from a standard person consumer's perspective, it's very difficult to differentiate what's accurate and what's not accurate.
I think this is really important. As scientists and as physicians, we're not trained to speak, lay science. This is not part of the that we were basically develop these skills to be able to do the work that we do to try to make these medical advances that help to solve these large biomedical issues. But I think that the pandemic is that is not okay, that there has to be a second lane to these critical disciplines in biomedical research, and learning how to speak the language of the population as a way that we can get the actual information from the source, as opposed to having interpretation and broken telephone plague the information landscape.
It was an opportunity to, in some ways humanize science by letting people, know that as best we could, that we were not behind the scenes scheming, trying to make a bunch of money. We were doing this. I mean, we're not making money from this. We are doing this to try and make a difference in the world.
We use this process we call design thinking. We use it in multidisciplinary teams, which you are in right now, which is pretty neat to see. It's a human-centered design approach. It's a kind of a balancing act between people factors, business factors, and technical factors. And innovation, we find, needs this balance. But we start with people, with what people need, with what people desire. And so that's a critical thing to understand here. And that's kind of part of this workshop, understanding what people need.
The people that we need to listen to are those that are in the public health arena, who have done the research, who have the expertise. And just because we found something on the internet that somehow justifies what we think is right, we need to be listening to the professionals who, this is public health, this is not politics.
1 out of 2 people don't have access to basic healthcare. And I said, we need to do something to change that. And it should be possible. And that's where initially I thought it was a problem of not having enough resources, but I really discovered very quickly that it wasn't lack of money. Money, yes, is important, but it was really the disconnect between the solutions that we have and the challenges that we have.